Namaste JVN. Myself, JVN Dr. Ravi Jain, Associate Professor in HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at JYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures on 24th of May 2024, we are discussing about the various disease conditions related to the old age. So, in the last lectures, we have discussed about the aging, the process of aging, and we have also discussed about various disease conditions, like we have discussed about falls, we have discussed about delirium. And today we are going to continue with more of these disease conditions. We will also be discussing about urinary incontinences, deliriums, and adverse drug reactions. So let us continue with today's lecture. Let us start with the urinary incontinences. What is urinary incontinence? Urinary incontinence is the loss of urine, involuntary loss of urine. Urinary incontinences are of the following types. We have urge incontinence, we have stress incontinence, and we have overflow incontinence. So what is urge incontinence? Urge incontinence occurs due to the depressor overactivity and results in urgency and frequency of the urine. Stress incontinence, this is exclusively seen in women and is due to the weakness of the pelvic floor muscles, which allows the leakage of the urine when intra-abdominal pressure rises, example by coughing, sneezing, etc. Overflow incontinence, that is most commonly seen with men, prostatic enlargement, and elderly. So we have three types of involuntary urination, which is urge incontinence, stress incontinence, and overflow incontinence. How to assess and manage the urinary incontinence? The assessment of the urinary incontinence, first of all, we have to address the contributory factors. What are the factors that are contributing to the urinary incontinence? The various factors includes UTI, urinary tract infection, severe constipation, various drugs like diuretics, hyperglycemia, hypercalcemia, reduced motility, and acute confusion. After the assessment of the condition, even if still the incontinence is continuing, then we have to establish the pattern of the urinary loss. We have to measure the residual urine volume. We have to assess for the vaginal prolapse and atrophic vaginitis. We have to assess the prostate by rectal examination. How to manage a case of urinary incontinence? We have discussed about three types of urinary incontinence, like urge incontinence, bladder retaining antimuscarinic drugs like solifenacin and clotridone. Stress incontinence, we have to advise pelvic floor muscle training to the patient, which includes the Kegels exercise and surgical intervention if unsuccessful. Overflow incontinence, which includes surgical relief of obstruction and prostatectomy. Another disease condition, which includes adverse drug reaction. What is adverse drug reaction? Adverse drug reaction is defined as any noxious and intended effect of the drug, which occurs at doses normally used in man for the prophylaxis, for the diagnosis or therapy of the disease, or for the modification of physiological function. So what is adverse drug reaction? Adverse drug reaction is defined as any noxious and unintended effect of the drug, which occurs at the doses normally used in men for the prophylaxis, for the diagnosis, and for the therapy of disease, or for the modification of physiological function. These are the cause of around 20% admission in those over 65 years of age. Polypharmacy is most common in old people and responds to the drugs, which are more variable. The clinical presentation of adverse drug reactions are diverse. Now, what are common adverse drug reactions? The common adverse drug reaction includes non-steroidal anti-inflammatory drugs, which includes the adverse drug reaction of NSAIDs are gastrointestinal bleeding and peptic ulcers with renal impairment. Diuretics, which includes renal impairment. The adverse drug reaction of diuretics includes renal impairment, electrolyte disturbance, gout, and hypotension. Beta blockers includes bradycardia, heart block, and hypotension. The adverse drug reaction of opiates includes the constipation, vomiting, delirium, urinary retention. Of antidepressant, it includes delirium, hyponatremia, and hypotension, false. Anticholinergic drugs, which includes delirium, urinary retention, and constipation. So the common adverse drug reactions of NSAIDs is GI bleeding and peptic ulceration with renal impairment. Diuretics includes renal impairment, electrolyte disturbance, and gout with hypotension. Beta blockers includes bradycardia, heart block, and hypotension. Opiates includes the constipation, vomiting, and delirium. Urinary retention. Antidepressant that causes delirium, hyponatremia, hypotension, and falls. And anticholinergics, which includes the delirium, urinary retention, and constipation. Now, how to manage adverse drug reactions? Management of the adverse drug reaction includes the failure to recognize adverse drug reaction may lead to the use of further drugs to treat the problem, which can worsen the matter. So if a person is using more drugs for the treatment of the adverse drug reaction, that will worsen the matter. Adverse drug reaction is a preventable disease condition. It is achieved by using a few drugs as possible at the lowest dose possible in an easy to take formulation, by ensuring that the patient understand the dosage regime, by reviewing medications regularly, and to stop or reduce the dose of the offending drugs or find out an alternative. So the management of adverse drug reaction includes failure to recognize this may lead to the use of further drugs and make the matter more worse. Adverse drug reaction is preventable. It is achieved by using few drugs as possible and easy to use formulation, and ensuring the patient understand the dosage of the regime by viewing the medication regularly, and to stop or reduce the dose of offending drugs and found out an alternative. Another disease condition of the old age is the dizziness. Dizziness is an impairment of spatial perception, that is relationship with the surrounding environment, and stability. So what is dizziness? Dizziness is an impairment of the spatial perception, that is relation with the surrounding environment, and stability. The term dizziness is imprecise, and it can refer to vertigo, pre-syncope, disequilibrium, and a non-specific feeling such as giddiness or foolishness. So any impairment of the spatial perception, relationship with the environmental surrounding, and stability. The term dizziness is imprecise and can refer to vertigo, pre-syncope, disequilibrium, or non-specific feelings such as giddiness and foolishness. Now, what are the clinical features? The clinical features of dizziness. The clinical features of dizziness includes lightheadedness, that is suggestive of reduced cerebral perfusion, vertigo, suggestive of labyrinthine and brain stem disease, unsteadiness or poor balance, suggestive of joint or neurological disease. So the clinical features includes lightheadedness, that is suggestive of reduced cerebral perfusion, vertigo, suggestive of labyrinthine or brain stem disease, unsteadiness or poor balance, suggestive of joint or neurological disease. The management of dizziness includes treatment of the cause. We have to treat the cause. Rationalization of the medicines have to be done. Correction of the visual impairment should be done. Treatment of the cardiovascular disorders and correction of dehydration. So management includes the treatment of the cause, rationalization of the medicine, correction of visual impairment, treatment of cardiovascular disorders, and correction of dehydration. Now let us discuss about the other problems of the old age. The other problems of old age includes hypothermia, undernutrition, infection, fluid balance problems, heart failure, hypertension, atrial fibrillation, and diabetic mellitus. So the other problems in old age includes hypothermia, undernutrition, infection, fluid balance problems, heart failure, hypertension, atrial fibrillation, and diabetes mellitus. Peptic ulceration, anemia, painful joints, bone disease and fractures, immobility, stroke, and dementia. Next, we come to rehabilitation. What is rehabilitation? To improve the ability of people of all the ages to perform their day-to-day activities and to restore their physical and mental and social capabilities as far as possible. Rehabilitation is done to improve the ability of the person of all the age groups to perform their day-to-day activities and to restore their physical, mental, and social capabilities as far as possible. The rehabilitation includes assessment of the nature and extent of the patient's problem, goal setting, which includes specific, realistic, and agreed between the patient and their rehabilitation team. Intervention that includes active treatment needed to achieve the established goals, and reassessment that is progress towards the goals. So what is rehabilitation? To improve the ability of people of all the ages to perform their day-to-day activities and to restore their physical, mental, and social capabilities as far as possible. The rehabilitation includes the assessment of nature and extent of the patient's problems, goal setting that is specific, realistic, and agreed between the patient and the rehabilitation team, and intervention that is active treatment needed to achieve the established goal, and reassessment that is progress towards the goal. Now, the management of aging is requires a multidisciplinary team and functional assessment. In the multidisciplinary team, we require a physiotherapist for the mobility, balance, and upper limb functions. We require occupational therapist for activity of the daily living, like dressing and cooking, a dietitian of nutrition, speech and language therapist for communication and swallowing, social worker that care needs, and a nurse for the motivation and initiation of the activities, feeding, continence, and skin care. So multidisciplinary team and function is required for the functional assessment, which includes physiotherapist, a mobility balance and upper limb function, occupational therapist for the activities of daily living, like dressing, cooking, a dietitian for nutrition, speech and language therapist for communication and swallowing, social workers who require care needs and motivation and initiation of the activities, feeding, continence, and skin care. So this was all about the geriatrics. Let us again revise the topics that we have covered today. We have discussed about the urinary incontinence, that is involuntary loss of urine. It is of three types: urgent incontinence, stress incontinence, and overflow incontinence. In urgent incontinence, it is due to the depressive overactivity and results in urgency and frequency. Stress incontinence is due to the weakness of the pelvic floor muscles, and most commonly seen in females. Overflow incontinence is seen in men due to prostatic hyperplasia. Assessment is done by checking the contributory factors like UTI, severe constipation, drugs, hyperglycemia, hypercalcemia, restricted mobility, and acute confusions. If still the patient is incontinent, then measure the residual volume, assess the vaginal prolapse or atrophic vaginitis, and assess the prostate by DRE. Management of urgent incontinence includes bladder-retaining antimuscarinic drugs. Stress incontinence includes pelvic muscle training like Kegel's exercise. And overflow incontinence includes the surgical relief by obstruction or prostatectomy. Adverse drug reaction that is caused due to the drugs taken for the prophylaxis, diagnosis, and therapy of the disease condition. Polypharmacy is very common, that is producing adverse drug reaction. Various drugs which are producing adverse drug reaction includes the NSAIDs, diuretics, beta blockers, opiates, antidepressant, and anticholinergics. The NSAIDs are causing GI bleeding and peptic ulceration, renal impairment. The diuretics are producing renal impairment, electrolyte disturbance, gout, and hypotension. Beta blockers are producing bradycardia, heart block, and hypotension. Opiates are producing constipation, vomiting, delirium, and urinary retention. And antidepressant that are producing delirium, hyponatremia, hypotension, and falls. And anticholinergic that is producing delirium, urinary retention, and constipation. How to manage adverse drug reaction? ADRs is preventable. It is achieved by using few drugs as possible, making the patient to understand the dosage regime by reviewing the medications regularly and stop or reduce the dose of offending drugs. Dizziness is impairment of the spatial perceptions. Clinical features of dizziness includes lightheadedness, vertigo, and unsteadiness. The management of dizziness includes the treatment of the cause, regionalization of the medicines, correction of visual impairment, and treatment of the cardiovascular diseases and correction of dehydration. The other problems of the old age includes hypothermia, undernutrition, infections, fluid balance problems, heart failure, hypertension, atrial fibrillation, and diabetes mellitus. Peptic ulcerations, anemia, painful joints, bone disease and fractures, and immobility and stroke with dementia. Rehabilitation is the ability of the people of all ages to perform their day-to-day activities. 4 steps in rehabilitation includes assessment, goal setting, intervention, and reassessment. Assessment of the nature and extent of the patient's problem. Goal setting is the specific, realistic, and agreed between the patient and rehabilitation team. Intervention, active treatment needed to achieve the established goals, and reassessment, that is the progress towards the goal. Multidisciplinary and team and functional assessment includes the physiotherapist, the occupational therapist, dietitian, speech and language therapist, social worker, and nurse. So this was all for today. I hope you must have understood the session properly. We have covered the geriatric disorders, and you can go through the e-notes provided by me on the portal. So this was all for today. Thank you very much. We will be meeting in the next lecture with a new topic. Thank you very much. Have a good day.